Hello, I'm Senator Camera Bartolotta. Thank you for joining us. Pennsylvania is gearing up for the implementation of a new managed care program that is expected to impact over 420,000 Medicaid recipients across the state. Beginning in January of 2018, aged and disabled residents of 14 counties will be the first in the state to be transferred into the new Community HealthChoices managed care program. Under this initiative, those who qualify for government-funded services due to their health and income limitations will be expected to choose from one of three state-contracted managed care organizations to coordinate their health and long-term care services. These managed care organizations will replace more limited service coordination that individuals have been receiving through area agencies on aging or other government contractors. With me in the studio to talk more about this change and answer your questions is Kevin Hancock, Chief of Staff for the Department of Human Services Office of Long-Term Living, Leslie Grenfell, Executive Director for Southwestern Pennsylvania Area Agency on Aging, and Rebecca May Cole, Executive Director of the Pennsylvania Association of Area Agencies on Aging. So I can't thank you all enough for being here today, for making the trip to Harrisburg just to answer some of these questions. And as we stated just a little bit ago before we got started, a lot of people in my district are very concerned about this change, and they're not sure how it's going to affect them and what things they may lose, what things are different. So, and you're going to be teaching me as we go. So I think we'll start with you, Kevin, if you would. Can you sort of explain to our viewers what to expect with this new change?
Sure. Starting with the definition, I appreciate the opportunity, Senator, to talk about this, and we're going to do all we can today to alleviate any of the concerns or fears people may have about the program.
I appreciate that.
Community Health Choices, or CHC, we like to use acronyms in government, is what we call a Managed Long-Term Services and Supports Program, and it includes a program with physical health benefits like a doctor's office visit or a hospital visit type of service, or a long-term services and supports, which would include services in nursing facilities or home and community-based services. And it's designed for adults with physical disabilities or older Pennsylvanians who would qualify for the Pennsylvania Medicaid program. The program itself is intended to broadly improve care coordination for services and to look for opportunities to integrate the services compared to the way they exist right now. The service system as it currently exists is somewhat fragmented, and we're looking for opportunities through the use of managed care organizations or MCOs to build an infrastructure that is designed specifically to have the managed care organizations work with participants to coordinate their care in a better way.
Okay. And Leslie, can you add a little something to that? What is it the Area Agencies on Aging is having to change or modify, or what are some of the questions that a lot of people are coming to your agency for?
Well, thank you, Senator, again for inviting me here today. We're one of the area agencies on aging located in the first phase of the community of the CHC implementation called the Southwest Zone. And so much like what Kevin said earlier, CHC provides an opportunity for some enhancements through the managed care companies to provide participants with more types of different services that might enhance their overall health being. So it does provide a number of enhancements that we think are going to be extremely important for people. The three types of people that are affected by CHC are adults that are 21 years of age or older, that are dually eligible. That means that they have both Medicare and Medicaid.
Okay.
So all those individuals that have both Medicare and Medicaid, persons that are on Medicaid that are currently residing in a skilled nursing facility paid for by Medicaid, and then those individuals that have been determined to be eligible for one of the current Pennsylvania aging waiver programs, such as the aging waiver or those with physical disability waivers.
Can you explain that just a tiny little bit more, what the waiver program really is? Can you?
Yes.
So
individuals that are on the waiver are on Medicaid, so they're financially in need of some support services. They also have had an eligibility determination that they're clinically eligible for a nursing facility, but prefer to stay in their home and community with enhanced services.
Okay, right. That was one issue that some of my disabled folks were really concerned about, because so many of them really do want to be at home.
Absolutely.
They want to use public transportation. They want to have a job. They want to be part of the community, and they were really nervous that maybe some of the waiver opportunities they were provided before might be compromised with this new plan. So this is something that it's good for them to know.
And I think the important thing for people to remember is what you're getting now, you'll continue to receive. And you are likely to receive something new or more or have better coordination. So you're starting at this point, but you may be able to get additional services that you aren't receiving right now. That's one of the benefits, I think, of Community Health Choices.
Okay. And the only thing I would add would be that the program itself is designed to enhance community-based living. Our primary goal for this program is to support the preference of people to be able to receive, as Leslie had stated, these home and community-based services in their own homes, to be able to work or maintain a life that is as independent as possible. The structure of the program and the way the services are going to be coordinated with the managed care organizations is really focused on making sure that people are be able to achieve their preference of staying in the community and achieve their own individual goals.
And that's so very important for a lot of these folks, because it makes them healthier. They participate in their community. They contribute. But also, on the other end, it's so much more expensive to be in a facility. So this really is a cost saver for Pennsylvania as a whole.
It could potentially be a cost saver, but just to be very clear, we have looked at this as being a service improvement program more than a cost-saving program. We've learned lessons from other states that have designed their programs to be budget savings oriented. Pennsylvania recognizes that there's always opportunities for efficiency and effectiveness in the healthcare system and in long-term services and supports, but our primary objective is to ensure that people are achieving their personal goals, and we've found that part of that personal goal is to maintain their services in the community.
Can you add anything to?
The other piece that I think is unique is that there's an ability to look at some different kinds of services. As I said, there's the additional services you can get. There's assistance as far as employment for folks who want to be employed. There's also housing assistance. That can be a really difficult challenge sometimes, is being able to find homes, find a place that you can live that's affordable, that also enables you to, deal with whatever kinds of physical challenges you may have, first floor living or one floor living or those kinds of things. So I think that's important too.
ADA compliance and
Right.
accessibility to transportation and all those other things that add to quality of life. Go ahead, Leslie.
Well, I would like to add too that what we've been hearing are consumers, participants in the program that might be fearful of losing services. So what I would like to stress today is that under the program, there's what's called a continuity of care period. So we have 180 days where the participants will continue to be served by the current providers and their service coordinators. So that won't affect anything for 180 days. And then at that point, should participants wish to make a change, they'll be able to do so. So there's that stabilization period, if you will, so that nobody needs to be concerned on day one, which would be January 1st, that there's going to be a significant change to their programs.
So during that 180-day period, their providers and themselves and family members and things, they can check into all of the other opportunities that are available and what changes there might be.
Absolutely.
And so that they can choose?
As Leslie stated, their service program is going to stay the same for 6 months, unless they want to make a change, as you stated. But during that time period, it gives them, I like the term stabilization period. It gives an opportunity for people to get used to having to deal with the managed care organizations, and also to explore what other options or new services may be available to them. And there are new services that will be available to them.
What would those look like?
An example, Rebecca named two focuses: housing. We're looking to to enhance opportunities for housing supports in this program as much as possible, helping people to obtain housing, home modifications, etc. Another area that's a significant emphasis for this program is employment-related services. We know that people, especially adults with physical disabilities, want to be able to continue working if possible. They just need some sort of support to be able to do that, and we have new services that are intended to really focus on that group of people and do all we can to make sure that they're able to keep working. And a third, which sounds like an odd new service to add, would be pest eradication. And the reason why it's a new service is because we've discovered that pest infestation in a person's home is a social determinant of health. And to be able to keep maintain health and safety in a person's home, we've added this service to it didn't exist before. We added this service to improve the living conditions for people.
That's wonderful.
And Senator, I'd also like to add that for the aging waiver participants, the coordination with the behavioral health managed care companies will be an added benefit for our aging consumers.
Oh, that's wonderful.
Currently, that program is not under a managed care program, but it will be January 1st. And so the physical health, the long-term services and supports, the behavioral health will all be combined. And providing a comprehensive level of service for older Pennsylvanians and persons with physical disabilities.
That's wonderful. So what are some of the biggest challenges that in all of your different organizations have you come across in Pennsylvania? I'll throw one out there, transportation. Transportation seems to be a real issue, especially in the Southwest. We have a real issue with public transportation in the Southwest. How does that influence and affect the people that you serve?
So transportation is incredibly complex. It doesn't matter if a person is eligible for Medicaid or not. Having access to transportation, depending on where you live, is always a very challenging problem. This program does offer and augments existing services for participants. It will offer emergency medical transportation, obviously, as it always would. The people who are eligible for home and community-based waivers that Leslie was talking about earlier are also eligible for non-medical transportation that helps people, may help them get to work or may help them with any type of community activity they may need. And a third type of transportation that will continue to be offered through the Medical Assistance Transportation Program or possibly otherwise is non-emergency medical transportation. And that would be when a person needs a ride to a pharmacy or a doctor's office or an outpatient procedure in a hospital. So that type of transportation would also be available through or related to this program. But transportation is incredibly complex, and we are always looking for opportunities to improve the transportation system for not only for this population, but also for people who need services, especially when they relate to healthcare. Sure.
I would just kind of expand on what Leslie had said about the behavioral health services. In a previous position that I had really focused on the behavioral health needs of older adults, and that's a particular challenge, is having that coordination between even just access to those behavioral health services. So the fact that these managed care companies are required to make sure that those behavioral health services are provided and are coordinated, I think is going to be a true benefit to seniors across the state.
That's wonderful. Yeah, because that's one of the issues that we're dealing with in Pennsylvania is that they have to, legally and by statute, they separate behavioral health from even addiction therapies and things like that. And we're dealing with so much of that, and not elderly folks necessarily, but there's some issues with elderly
this population
folks.
is affected just like every population.
It is. Opioids are an issue everywhere,
Absolutely.
but for some reason in Pennsylvania we put a huge barrier up between the two of those services, and there's most of the time, probably 80% of the time, an addictive issue is related to a mental health issue. So I'm really glad to see that there's behavioral health thrown into this as well. That's great. That's very good to know. What are some of the other things that are in this this rollout that people need to be aware of? And again, I was very nervous about this because Southwestern Pennsylvania, they're calling us, a lot of people say guinea pigs, but we're the first. We're the first. Sometimes it's good to be the first. But a lot of people are really anxious that there may be some glitches or some problems in the 180-day safety net is a really good idea for the transition. But what are some things that you might be looking out for as a potential problem? I'm not putting you on the spot, but I mean, if there's some people might have mentioned it to you
Sure.
and you have an answer for it, or if there's something that you're concerned about.
So we want to make sure that people understand that we will be paying attention throughout the continuity of care period and after the continuity of care period. A lot of people, especially people who are currently receiving services in the home and community-based waivers, they've told us that they're concerned that after that continuity of care period is over, that they're going to see reductions in their service plans, especially the hours they receive that help them with personal assistance. We will be paying very close attention to that, and there may be circumstances where it may make sense for a person to have an adjustment in their service hours, but in most cases those hours were established based on their need, and we will be working with the managed care organizations and really asking the question, for everybody we see where we see a reduction, why did that reduction take place, and they'll have to justify it to us. So that's an area that we've heard a lot of concern.
What we're hearing as the Area Agency on Aging, responsible for older adults in Fayette, Washington, and Greene County, is the issue about how will my Medicare be affected for seniors, and that question is really easy. Your Medicare is not affected unless you, as the participant, wish to make a change to your Medicare plan. So Medicare will always be the primary insurance for older persons with Medicare. So we don't want people to be concerned. And I'd also like to mention that through the Pennsylvania Department of Aging, all area agencies on aging, all 52 of us in the Commonwealth of Pennsylvania, have a Medicare health insurance counseling program called a PRIZE.
Okay.
And so we're available to take any calls. We're available to do individual searches to help people find the best plan that's available for them. And certainly we also are able to help with some questions that they might have about Medicaid at the time as well. So I just want to mention that is a nice resource for consumers and participants throughout the region.
So how can people find out where their local area agency on aging is? Is there a place they can go to find a list of the 52 offices you were just describing?
Yes, they can go to the Pennsylvania Department of Aging website.
Okay, and we'll have a link on my website as well.
They can
some
go to the Pennsylvania Association of Area Agency on Aging website as well and find their local link to the Area Agency on Aging that might be able to assist them.
Yeah. And there's so much information that you provide to people if they just pick up the phone and call.
Yes.
There's so many things that you can help people with that they may have never thought they could have gotten assistance with before.
Yes, please just call us. We all have toll-free numbers that are available so that there's no cost to participants.
And knowing that all of you are available and everyone in all of your departments are available to answer any kind of questions that these people may have, and just sort of assuage those fears of change and just wondering what's coming up. So that's extremely helpful. So Kevin, please, yeah, please go right ahead.
So
that's what we're here for.
So I'm not going to use this opportunity to plug our enrollment website.
Okay.
For information specifically related to CHC enrollments, we're encouraging participants, and those participants who received a packet, and they would have received a packet of information in October, if they're going to be one of the people who are going to be enrolling in Community Health Choices. If they want more information on the program, they can go to the Enrollment CHC website, which is www.enrollchc.com, and that will provide information on the managed care organizations, their offerings, their network, and what they would need to do to enroll. And then if they want to call our independent enrollment broker, the independent enrollment broker can answer those questions as well, provide information on the managed care organizations' provider networks, and also help them go through the enrollment process for the managed care plans. And that number is 1-844-824-3652. And the line for those individuals who are hearing impaired is 1-833-254-0690.
Right, we're going to have all of those numbers and websites and everything available, not just on our screen as you're watching, obviously, but on my website. You can even call my office if you have questions, and we can direct you into the right, the right places to go. But this is not a scary thing. It's something new. And it sounds to me as though that there are opportunities to really enhance service to a lot of these individuals who need it and rely on your services just for great quality of life. Go ahead, Rebecca.
I wanted to just make a point of mentioning that in order to make that call a little bit easier, especially if they're calling the enrollment broker, to sit down and figure out all of the providers that you have. Your doctor, your specialist, podiatrist, your in-home care provider, all of those, write them all down so you have them. And then you can call the IEB and go through that list, and they'll be able to tell you which plans have those particular providers or don't. And it's important too to remember that this choice is up to you. You are the one who can choose what's more important to me. Is it that I really want to keep this home provider, this home care provider? That's something that's a very personal type of a provider, helping with bathing and dressing and those kinds of things. Maybe that's what's most important. So as you're going through your list of providers, think about what's most important to you, and even star them so that when you talk to the IEB, you can see what it is, which plan might be the best fit for you. The other thing that I think is important to mention too is that there is something called auto enrollment that is happening between right around now till the end of the calendar year. And that is for people who haven't chosen. However, if you as a participant have found out that you have been assigned to a managed care company, you can change it.
Okay.
Anytime up until the end of December, and even within, after January 1st has started, you also have an opportunity to change. So it's not like you're locked into the same managed care company for the entire year. You have an opportunity to change it. Roughly, it takes about a month or so to get that change to be in effect after January 1st. But remember that before the end of December, you can change at any time. Even if you chose one and you realize after you're thinking about it a little more, I think I want to go with a different one, you can go ahead and do that.
Great. And I love your suggestion to list your priorities and have them all available when you make the phone call. Because some people, they get on the phone and they think they remember everything they want to ask, and they leave something really important out. So that's a very good tip. And have a family member, have someone that you trust with you when you make the phone call.
Absolutely.
Just to be sure that you're really asking all of those things and getting the answers that you want, that you really need to make a good choice.
So I'd like to mention that there has been a comprehensive education and outreach plan that has been in the Southwest Zone in particular, and then we'll roll out when the rest of CHC rolls out across the state. But in the Southwest Zone, there have been a number of community meetings and forums that have been held. So for the service coordinators, those are the ones that are working very directly with all the participants. And so all of the service coordinators have been trained, and they've spoken to each and every single one of their participants to inform them of the up and coming change, so that they were going to be prepared to receive the documents from the Commonwealth, and then be able to make their phone call to the IEB for more information. But Rebecca, if you could speak a little bit more about, I know that's something that we've been doing with the Area Agency on Aging Network.
It's actually been a really nice partnership between the area agencies on aging and some of the service coordination entities that tend to serve folks who are under 60. We have this sort of, I don't want to say separation, but kind of specialization maybe for the AAAs, kind of focusing a little bit more on the senior side of things, and these other groups focusing on the folks who are under 60. And so we've had a total of 39 community outreach and education sessions. We've had a number of people who were trained to facilitate those sessions. We have reached about 2,000 people across the area, which we are very, very pleased. I know we're pleased with. I'm hoping that DHS is pleased with that number.
We are.
Good. And I did
Got that on
hear
camera.
that, I think it was yesterday, the estimate in the number of people who have already selected their plan is around 30,000. I don't know if that's changed.
It's around 30,000.
Yeah, around 30,000
And that's just in
people,
those
so.
14 counties being affected immediately as the first round. That's a good number.
It is a good number. We're very
That's a
happy
really
with
good
it.
number. Great.
Yes.
Good.
Compared to other states, this is a very high number. We attribute it largely to the communication that was managed through the area agencies on aging and service coordination agencies, as well as interest of this. I think that the population of people who are going to be enrolled in CHC, they pay attention to their health care, and it's been just been something that they wanted to be part of. So we're very happy to see that.
So there's the training for the
Service coordinators.
service coordinators, but also, Kevin, you wanted to say.
Sure, nursing facilities have also been engaged in the enrollment process as well. Their staff have received training on what this change means for their residents, and they've worked with their residents and have been very helpful in helping residents select a managed care organization that was best for their purposes as well. We also wanted to note with nursing facility residents and the nursing facility system is a very, very significant part of Community Health Choices. In recognizing that and recognizing the fact that nursing facility residents view that nursing facility as their home, Community Health Choices will be, if a person is receiving nursing facility services in this program at the point of implementation, regardless of whether or not that nursing facility participates in a managed care organization or not, as long as that nursing facility is participating in our Medicaid program, those residents are never going to be asked to move. So at the point of implementation, they'll be able to stay in that program indefinitely. The nursing facilities are aware of this as part of their communication to residents. They've made sure that was communicated to the residents, and that's been built in to make sure that residents understand how this change affects them.
That is really wonderful. And I can't thank you enough for all of your information, for all of your hard work, and to be there for all of these very vulnerable people. So again, we're going to be having all the information that you need, some links and some contact information to help provide more and more information. But that's all the time we do have for today. If you have any questions about this program or about any state government issue, I'd really like to hear from you. The contact information is going to be displayed momentarily. I'm Senator Camera Bartolotta, and I really thank you for watching. We'll see you next time.